Oh, good.
Okay. Yep, thank you. Welcome everybody to the Asia Pacific Community Call for today. Our agenda item, you can see here, if anyone's new and they would like to announce themselves, what they do, what they find interesting, please let us know. Today, a lot of it is really going to go over some chapter updates from the 6 different chapters. They're going to give a bit of an update of what's going on within each chapter. Do we have anyone new here who wants to say hi to everybody? Okay. But before we go into that, I do want to provide some update, some fantastic news on the Western Hemisphere front. So for those of you that aren't aware yet, the symposium for 2021, the Global Symposium, is now open. It is still going to be virtual. We did have a debate on whether or not it was going to be in person or if it was going to be virtual. Given that it's in actually September, we're still going to keep it virtual. Okay, so you guys can register. This is actually on the community page. There's a link to register. The dates are September 12th through the 15th. The other thing that is now open is the collaboration showcase. So if you guys have an interest in the collaboration showcase, please go ahead and register as well. It's up here. For those who are not as familiar with the collaboration showcase, basically those are the poster sessions and the abstract sessions that folks can present at. What we do there is you submit to the, you put in your abstract submission, and then there's a steering board, a scientific committee board that will review your abstracts and then inform you whether or not you've been accepted or not. That typically takes about a month and a half or so. And it's in multiple areas, so you could do it in technology, you could do it in research, you can do it with methodology. There's a few different areas that you can pick. And if you guys have any questions or have any issues, let me know. I'm actually on that board, and the template is pretty much the same as last year with a few exceptions. I think we limited the number of characters that you can use now. And so instead of the page limit, we did a character limit because it was hard to get everybody fit everything in 2 pages. So it's a character limit now. So again, if you have any questions or don't know what to do, reach out. I can help you with that if necessary. Also, there is, for those that are interested, it is going to be 8 a.m. Eastern Standard Time, so that's not too bad on the Asia Pacific side, but there is we are starting an education group. So this group's purpose is to figure out how to be able to disseminate education throughout Odyssey. And some of our colleagues are in there. If you have an interest, you can attend. There is no link yet, but again, you can go there and it will, you can go and join the Odyssey working group, and you will get all that information from there as well. So those are the big things that are going on. There are some other stuff that is going on out there, but you can go ahead. Again, everything is in odyssey.org under this week in the community calls here. So with that, I am going to actually go into Korea. So Chan, do you want to present, or would you like for me to present?
Yeah, could you just click the slides? So yeah, I'm okay. Chan here, and I'm currently a professor in the Yonsei University in the Department of Preventive Medicine. Maybe I sent my slide on this morning, and you may not receive that.
Is this the one?
Oh, that's right. Thanks. So the biggest news in Korea is that we actually have mapped that Korean nationwide administrative claim data into OMOP-CDM ranging from 2010 to 2019. This is really huge amount of the database data, and actually it covers virtually entire Korean population, which is 50 million patients. And because Korea has the single national insurer system, it encompasses almost every medications prescribed in the hospitals and and dispensed in the pharmacy. So It was really distinctive database in the world, and we are so proud of that we achieved this. And as you may know that the recent HIRA data of COVID-19 actually used for the COVID-19 research of Odyssey, and it was distinctive from other databases because usually the European database claim database only covers the primary physician's prescription, but in the HIRA's database, virtually the whole doctor's prescription are recorded in this single database. So that's the difference. And the other thing is that this insurance system actually covers almost all Korean population. So it was really, I'm really proud. And we will have the meeting with HIRA to discuss how to use this OMOP-CDM data for further future research, and I can update what's going on and next time by using this database. And the other thing is it's quietly personal, not that Korean nationwide. So we are seeing that more Korean hospitals, including 3 hospitals in Yonsei University Health System, joined Odyssey with available OMOP-CDM databases. So Yonsei University Health System comprised of 3 big hospitals, including Severance Hospital, Gangnam Severance, and Yongin Severance Hospital. This is one of the most biggest healthcare system and the hospitals in Korea, and we prepare the OMOP-CDM data for the entire EHR system, and it's monthly updated now. So the infrastructure is quite, I think, robust, and I hope that we can conduct a multinational and multi-institutional study by using this system too. Thanks. That's it for Korean.
That is a lot. It's wonderful to hear all the stuff that's going on in Korea and how you can get the national claim system over to OMOP. That's a lot of effort. So congratulations. Awesome. Then we're going to move to Odyssey China. Professor Xu, do you want to present or do you want me to just go down?
Yeah, just go down. I only have 2 slides, so no worries.
Okay.
Oh, it's not my slide.
We added this. We wanted to make sure. Yes, we added these to make sure so these are your slides.
I don't have that slides, but anyway, yeah, that's about myself. My name is Hua Shu. I'm started Odyssey China about like 4 years ago. And actually, next slide, please. So we actually recently have an organization change. I just want to say we actually, I'm actually currently located in the US, but we actually now have 3 folks from China on board as co-chairs for the Odyssey China. So that's kind of one big organization change. We have Dr. Yi Zhou from Zhongshan University, Dr. Lei Liu from Fudan University, and Dr. Hui Lu from Jiao Tong University. So plus myself, so 4 of us together are co-chairing the Odyssey China chapter. So we are trying to getting more local Chinese folks to actually involve and move more forward towards the goals we want to achieve. And we are actually all 3 of them, each of them will actually sort of direct one area of focus. And Dr. Yi will work on training and engagement of the community. And Dr. Lei Liu will focus on the methodology and the tool development. And then Dr. Hui Lu will focus on conducting clinical study, network studies, things like that. So that's kind of one big change. And we used to have quite a lot of working group like we had in the US or the global Odyssey, but we're actually making it more flat. So we remove all those working group structure, more focused on those 3 different directions, just like our priority for the year. And next slide, please. So one of the recent sort of active work is really about, we actually worked on this about 2 years ago on Chinese vocabulary, and the IQVIA team also helped actually map to 4-digit ICD-10-CN code to the Odyssey SNOMED, basically from the Chinese concept. ICD-10-CN is the ICD-10 Chinese version, but they mapped 4 digits to the SNOMED, which is in the Odyssey vocabulary. So we are actually trying to now extend that work a little bit to including 6-digit ICD-10-CN code to SNOMED. But in addition, we are also mapping local Chinese terms, concept we collect from 6 hospitals. I actually listed those terms here. From 6 hospitals, we collected different, this is actually number for the disease concept. So those are the concept, local terms we collected from 6 different Chinese hospitals, and we're actually trying to map that to the ICD-10-CN as well as SNOMED, hopefully. So there's a kind of 2 different vocabulary work, and now at least 5 volunteers actually showed interest and they're going to help with this. We're actually call for more people to join, and we are actually setting up an online-based tool. So you will be able to assign this mapping work to different people. We will have some NLP-based approach, actually do some auto mapping, have candidate suggestion for the mapping. Then the people will actually review it and confirm or revise it to correct all the mappings. So basically, that's kind of something going on at the vocabulary. Basically, that's a second direction method and tool. And on the clinical study side, Dr. Liu is actually working on a collection of all the mapped data set, then trying to have a list of potential projects we want to do this year. We are not aiming very high number of study. We're just thinking about 1 to 2 studies, so that a lot of place the data was not very ready. And on the training side, I think they are coming up a plan by working with the IQVIA team together. So that's pretty much that's it, the update from me. Thanks, everyone.
Anyone got any questions for Professor Su? So I have something I want to ask. So for like the vocabulary mapping, you guys split it out into phases, right? Because it makes because you guys have so many, is that why you split it out into phases, right? To start off with what we did 2 years ago, and now you guys are going down to the lower level, or is it because that what we did 2 years ago, or isn't good enough that a lot of the mappings are too high level?
No, we started 2 years ago, but we realized there's so much work, and we stopped. Now we just pick up again. Just that because you see the presentation from Lei Scoop, just showing a lot of terms still cannot mapped, or it's not in the English CDM. So that's why we're thinking we should go back and revisit this whole vocabulary issue again. So, and then you guys already did this ICD-10-CN 4-digit mapping, right? That's what's in the CDM right now. And we're just thinking maybe the 6 digits, that's a natural next step after the 4-digit mapping. And now there's actually people volunteer to help. So we want to just move step by step, trying to get more things done.
I think it would be great if, I don't know if those in the China working group, if anyone wants to present in one of our future calls here, to talk about what you guys have done and how you guys have done it, as well as I know the issues that you guys have run into. I think that would be great learning lessons for some of the other countries who are still trying to do the same thing.
Yeah, if you guys have a language issue, that might be something we can share. Yeah, we do have that mapping tool available. I'm actually right now, I think Dr. Hui's lab is actually helping us set up the tool.
Awesome.
So we can allow other people to access and work on the mapping together as a team.
Wonderful. Seeing if you can coordinate something with Professor Xu about trying to get their team to join us for a discussion on the work that they're doing on the vocabulary side in the APAC call. So anybody else got any insights or any questions for Professor Xu? Alrighty, I am going to move over to Japan. Professor Haramatsu, I see you're online. Oh, you're on mute.
Sorry, can you hear me?
No problem. Yes.
Yes. Okay. So in Japan, yeah, I'm Hiramatsu, and I'm running Odyssey Japan. So next slide, please.
Okay.
Yes, in Japan, yes, recently a guy is willing to do mapping, especially drug mapping. So he had a plan. He has a plan. So we're gonna start the plan and do some mapping. So maybe we will have mapping within this year. And other measurements and diseases, yeah, we have another plan. So we're gonna have some mapping, not perfect one, but some one we do in this year, I think. Yeah,
awesome.
That's
great.
actually, yes, and we are wondering one thing about drug mapping, about for Chinese medicine drugs, herbal drugs. What did you do in China?
We skipped it.
Skipped.
Yes, we I don't know, Professor Hua, if you want to speak about it, but I believe we skipped it. We said we were phase 1, Western medicine first.
No, it's like this. So the Chinese medicine, there's actually two types. One is really about those herbs and all those things. That was skipped. But then there's also I don't know what's the exact name, English name for those drugs. Is that patent drug or something like that? So if they are, they also extracted from those herbs. They made something like a pill or something. So for those drugs, we did include them. So but the pure like herbs and those Chinese, we are not including them. But if they made something like a vial or like a pill, we do including, because they do have a name. But of course, there's no mapping to the English concept, English drug, right? Because then that's only that Chinese drug name is available.
So that's similar in Korea, and the similar in Korea. So our SNOMED itself is actually used for the United States only. So we do find that many drugs in Korea, including actually comes from Japan and Japanese pharmaceutical companies, and or some medications actually contains the herbal ingredients, and some of them we can find the RX norm extension concepts for some of them, and we cannot for the others. So we usually map some mappable concepts into RX norm extension concepts, and we pass others.
Yeah, I think we created RX norm extensions for all the ones that we couldn't find in RX norm when we released the Chinese vocabulary 2 years ago. So some of them do exist right now in RX norm. And that may be something we can work through. If you can't find them in RxNorm extension, then again, if there's a commonality between the different Asia countries, then we can add them to RxNorm as RxNorm extensions. So yeah.
Yeah, so we have a paper on like normalize the Chinese names to RxNorm. I will put the link in the chat.
Wonderful. Anybody got any questions that they would like to ask Professor Haramatsu from Japan? Okay, I will move on to Odyssey Taiwan, and I believe we have Jason here from Taiwan. Do you want to present your own, or would you like me to just keep going?
Can I use yours?
Yep, of course.
Briefly introduce myself. My name is Jason Shi, and I am an assistant professor in College of Management in Taipei Medical University, and I'm also a vice dean and Office of Data Science in TMU in Taiwan. And currently, I'm a co-chair of Odyssey Taiwan chapter. Next page. Yes, let me take this chance to introduce the core members in the office. And Mark Su, Professor Mark Su is also the co-chair of Taiwan chapter, and he is the dean and Office of Data Science in our university. And actually, he's my director. And Professor Alex, Dr. Alex is a data scientist, and he is a research fellow right now in our center. And actually, he helped us to do OMOP common data model to bridge the database, our database to Odyssey platform. And another two guys includes Fong and Yuda. They are my PhD students. And actually, Alice is originally from Vietnam, and Fong is also originally from Vietnam, and Yuda is from Indonesia. Okay, and both of them, Fong and Yuda, are my PhD students right now. And Cherry is my administrative assistant, and she is also a data scientist. And she helped us to do organization of this office. Okay, please, next page. Yes, here are our goals for this year. And number one is to create a website, our chapter website. And then number two is to develop another 2 sites and to increase more members to join us. And the last one will be to participate 2 or 3 international research projects, and eventually to initiate at least 1 project. Okay. Next, please. Yes. So we just start our website established. So because we just joined Odyssey at the end of last year. So this is the format, the draft of Odyssey Taiwan websites, and I would actually, we will do these websites bilingually, by using English and also Chinese. Okay, next page. Next slide. Yes, this is about the goal number 2. We would like to invite more hospitals and to help them to do the OMOP common data model. And here are 5 hospitals. They are interested in Odyssey, to join Odyssey. So including Chimay Medical, including National Taiwan University Hospital in Northern Taiwan, and Shouchuan Hospital, and Tong Chonghe Hospital. Both of them are in the middle of Taiwan. and Jiayi Christian Hospital and Chime Medical Centers are in southern Taiwan, and we have a meeting with Jiayi Christian Hospital on March 16. So we hope they are the first another hospital who can join Odyssey and have a OMOP common data model. Next page. Yes, the goal number 3 to build TMU Odyssey OMOP common data model. Actually, we have done that, and we start to try to conduct international collaborations, research, and next page will be the first one. We have already joined hypertension study, and also next page in the DOAC project, and also we hope that we can join more international collaboration studies in the future, and also the commercial studies sponsored by pharmaceutical companies. Okay, next page. Yeah, and also we followed current international studies created by Odyssey, and we hope to become a bridge to let more members or experts in Taiwan, and who are also interested in to join international collaborations. We try to collect those information over time, and to distribute this information to experts or physicians in hospitals. So we hope that more students or more experts can join us in the future. Thanks. I think that's
Awesome.
it. Okay.
Wonderful. Anybody got any questions for the Taiwan chapter?
I think all members are online right now, and they can do contributions in the future.
Yeah, I have to mention that my study is enlisted here. Thank you for this.
So I have a question. Like, I see that you guys are reaching out to other hospitals, and I'm sure other chapters may have the same interest. Like, how are you convincing these hospitals to want to join the community, right? Because the Taiwan chapter is quite new. How are you getting these guys to like the meeting that you had in March? How are you convincing these guys that joining the Odyssey community is a good thing and it's going to be great for their research? You know, we can spew it out here, but how are you guys doing that?
Actually, the president and the vice president in Taipei Medical University are very support these projects. I mean, Odyssey. So they have some connections with other hospitals. So that's why he introduced the benefits, the chance of Odyssey to them, and they think that is quite interesting, and they also want to join us. So that's why we start to have a meeting with all of them and try to encourage them to create like us to bridge the infrastructures about the data model, and then we will help them in the future.
Cool. And I do know that there's a study coming down the pipe for Pioneer. So once I get information for that, and I know they are very interested in getting Asia Pacific folks to participate. So once I get more information from the Pioneer folks, I will announce it here, and then maybe you guys can all join that one. But it's on prostate cancer. I believe that's what the study's on. So cool, wonderful. Lots of activities going on. Yes, Professor Xu.
Mui, is the chat function disabled in Teams? I couldn't find it.
I can't either, so I don't know. But
I still I tried to put the link for the paper, but I searched again and again. I couldn't find this chat
Can you
function.
put it on WeChat and we do it? Because I can't seem to do it either, but luckily I have the web version open so I can post. So I have both the desktop version and the web version open.
Yeah, I think it must be somewhere in the setting. It was disabled.
Jing, can you check the settings since you're the owner of this one? But yeah, I'm not too sure.
Okay.
Yeah, I'll check that, and Professor Xu, please send me through WeChat because I can still post. So I'll post now.
Okay.
So maybe it's just you and me, Professor Xu.
Because I can see the messages. Okay.
Really? Okay.
Amazing. All righty. Odyssey Australia. I believe we have Nicole and Doug.
Yeah, it's just Doug here. Do you mind if I use my own slides? Can I share them?
Yes. Yes, feel free.
Okay, thanks.
I will stop presenting.
Thanks. Okay. Just get the right screen. Just a moment. Okay, can you see my slide? Yeah.
Yes, we can.
Yeah, good stuff. Okay, look, sorry that Nicole can't make it today, but it's a pleasure for myself to be able to be in the meeting today and present what's happening in the Australian chapter. So the URL for our chapter is here, and we're certainly working to encourage and enlarge the number of participants that we have in Australia working in Odyssey and OMOP. So I'll not go through all of this just for the time, but basically Nicole is our president, and also if you're looking for inquiries, Roger Ward is able to help as well, and Roger's actually online just now. Myself, I'm a professor in health data science at the University of Melbourne, and my particular interest in this is about trying to provide uplift right across Australia, and I lead a national collaboration looking at data quality and standardisation that represents about 95% of all researchers. So I work quite closely with Nicole to try and promote these sort of activities. We've got relatively modest ambitions for this year. We just started last year as a chapter, and I suspect we might actually do better than our modest goals in this coming year, but we're looking to at least convert 5 clinical data sets into OMOP. And in particular, what we're trying to do is make the vocabularies and translations openly available. So we're trying to do this very community-based, and we do want to encourage more and more our participation in international research studies, and also looking at what we can contribute into the international community for the platform. I'll come back to that. So where are we just now? Well, in the primary care, so in the general practice space, University of New South Wales kicked things off a couple of years back actually with converting data from 18 GP surgeries, and we've worked collaboratively with them now, and we've just finished our first ETL for 120 practices in Victoria, in the state of Victoria, which covers about 2 million patients. And there's a further project pending to expand that further. And for, well, a couple of projects with outcome health and MPS medicine insights. That's exciting that the community data, we're really starting to make some inroads. And we want to be able to ultimately link community data with hospital data, and of course the common data model makes all of this a bit easier to achieve. So we already have a couple of hospital data sets that have been converted that are based on Cerner, if people know the Cerner EMR. And we've got funding now to extend that program to convert all of the public health data in the state of Queensland, which is the northeast of Australia, as well as 2 other hospitals. So basically we're trying to really expand and use these hospital data conversions to try and encourage other hospitals around the benefits of doing this. We've got work here at University of New South Wales about mapping oncology data, and we're also mapping oncology data in Victoria. This is pending in the coming year. And I think government administrative data is exciting as well, what's happening in South Australia in this space, and there's a slide about it, so I'll just move on. We participated in the COVID-19 study-a-thon, UNSW contributing flu data, and there's a study published with the URL here, which is on the common slides that the group should have. And we've been working certainly with Nicole's group has been working on the Odyssey APAC research study in hypertension. And UMAIS, this is an international piece of work as well. I think Nicole could report on this better than I. Possibly, unfortunately, I'm not much across that piece of work. Others question mark. It's kind of interesting. Sometimes people are doing things we don't yet even know about. So this is quite good that things are actually expanding fairly fast here. In terms of our contributions internationally, we have already tools in Achilles using the CAN framework for assessing data quality. But what we want to be able to do is develop a tool that people can use to assess quality and characterize the data before it's converted to OMOP. We see that as a major omission really at this stage. If you've got rubbish in and you've got rubbish out, so we want to be able to provide a mechanism internationally for people to have a standards way of assessing the quality of the data before mapping. And we're also looking at how we can map some of our government metadata standards to things like OMOP. So Ty, are you there? Do you want to speak about what's happening with PBS?
Not particularly, but I will. Yes, as Dougie mentioned, it's a government subsidy-based data set. So here in Australia, we have the Pharmaceutical Benefit Scheme, which we colloquially call PBS, and made available to us is a 10% sample of that data set. So we've successfully converted that to the OMOP-CDM. It's an interesting data set because it doesn't have conditions or anything like that. It's a purely medicine-based one. But should provide good insights into drug utilization and things like that. And there's a few stats there for anyone that's into numbers, but that's probably enough. I shouldn't hold up the meeting too much longer.
Thanks, Ty. So last slide here. So just to say that we've got a webinar series. The next one is from the University of New South Wales with a good friend, colleague of mine, Tim Churches, and this is about how they're doing the oncology transformation here. So really, the last thing to say from Australia is I guess one of the interesting things is we're trying to encourage the open publication of a lot of our mappings from custom terminologies and things like that. And an area we're looking at is whether we can start building tools that allow communities that are not technical to be able to curate terminology mappings. Because it's a fairly technical area these days, but sometimes you're needing medical people really more involved in the curation of that, and also even the curation of phenotype definitions. So I'll leave it there, and thanks very much. I'll stop.
Thank you. Anybody got any questions for Dougie? So I have a question. The last presentation that you talked about, the webinar, is it okay if we post it on the Asia Pacific update on Odyssey so that others are aware of that?
Absolutely, we'd be absolutely delighted. Thank you. Yeah.
Okay. We'll collect that. I think I have it in the deck that I don't have it in my deck. So if you guys can send us the updated deck, I will make sure to call have the team call that out so that they'll post it as part of the Odyssey APAC to get more folks to have an interest. It's the same with any of the chapters. If you guys have events that you want the Odyssey global team to be more aware of, just let me know and send me the links, and then I will be able to do that. So, okay. So last but not least, we have Singapore, and I believe we have Morning on the line.
Yes, yes. May I attempt to share my
Yes,
slide?
of course.
Yeah. Okay.
Because that's the only slide I have for you anyway. So.
Okay, let me see. Hold on. Why am I looking? Sorry. Why am I sharing my Microsoft Teams?
Because you're sharing your Microsoft Teams.
Okay. Can you stop my sharing? I don't even
Hit
know.
the little X button. So hit the little X button.
Okay.
Yeah, there.
How do I share PowerPoint then?
So when you share, it will pull up a bunch of stuff. Yeah, now you're sharing your desktop. There you go.
Okay, you're looking at my PowerPoint. Okay, cool.
Yes, now we see your PowerPoint.
Okay.
Yes.
Okay, awesome. It works. Okay, hopefully nothing funny will pop up on my desktop. Okay. Anyway, yeah. Good morning, everyone, and good afternoon, good evening for someone. Here's a quick update for the Singapore chapter, and following the format, a quick introduction of myself. You can call me Morning. My Chinese name is Meng Ling. I'm a faculty in National University of Singapore. Now leading the healthcare program in Institute of Data Science, and also the co-chair for the Singapore chapter. And joining me today also Dr. Niam, who is also our co-chair in the Singapore chapter, and also the group CTO of our National University Health System cluster in Singapore. So I will update a few research initiatives happening in Singapore related to Odyssey's OMOP. One of the things that's happening is that we are now setting up a collaboration with this national initiative called AI Singapore Agency on a Federated Learning Project. Some background about this agency, basically, or this funding agency is part of the Singapore National AI Initiative. Their first phase funding is about 100 million, and second phase, I was told, is about 250 million Singapore dollars. And as I show in here, they support things ranging from AI research, AI technology, and all the way to startups. And particularly, the things that we are working with them is a technology called federated learning. So for those who may not heard or are new to federated learning, a very brief introduction of what that is that, and it's quite applicable to healthcare. It's very applicable to a scenario where you may have some difficulty for pooling all your data from multi-institute to a centralized data hub to train your model. In the federated learning model is that rather than integrating the data, we distribute the model to multiple sites or institutes and let them train locally, while the errors and weights and all the updates will then be collected, centralized, and update the model distributedly. So as you can see from this graph, the federated learning shares a lot of, I think, the belief and also the ways of collaborations very similar to what Odyssey's the OMOP-CDM is practicing anyway. So we see this opportunity. So we are now working with AI Singapore, the team, in particular Dr. Jian Su's team. And the initiative is that to support federated learning across all the public healthcare clusters in Singapore, the first step is that we have to standardize the clinical data. And naturally, of course, Niam and I strongly recommend Odyssey OMOP to be our national data standard to be integrated. And I think in this juncture, it's perfect timing for me to ask Dr. Niam if he can open his mic to share with us more about our MOH national initiative for this data standardization.
Yeah, hi, good afternoon, everybody. I'm sorry it's a bit noisy. Yeah, so in terms of the national initiative, we've managed to convince our Ministry of Health in Singapore to map the national databases to OMOP so that we can open up the possibility of collaborating with multiple sites in Singapore. In Singapore, we have now 10 public hospitals. These are all, they range from 1,600 beds to about 800 beds. So in total, we are talking roughly about 5,000 beds in Singapore, where hopefully we can get all the data to be mapped to OMOP. And going forward, we look forward to being able to participate in more Odyssey type projects. Thank you.
Thanks, Dr. Niam. And as Dr. Niam mentioned, we do start to participate in some of the APAC studies and international collaborations. So besides the APAC hypertension study that we are part of, here is another example of the study that we are working with partners from UNSW. And for this study, let me invite my Selva from my team to do a very quick update.
Hello everyone, Selva here. I work as a research associate under Prof. Moni. So yeah, I'm going to present a high-level overview of our project on T2DM phenotype algorithm validation study that we are currently planning. So I work along with Jitendra from UNSW, who has also been providing valuable inputs to this project. So I would like to thank him for his guidance. Yeah, so basically what we are trying to do is build T2DM classification models and assess their performance across sites. And currently the best available ground truth for our respective data sets is for at least for NUS data set is will be using EPBR and rule-based algorithm for assigning labels. So, and we plan to build the models using OMOP-Learn, which is a Python package for prediction purposes. This is similar to PLP package in R. Yeah, so once we build the model, we plan to exchange the model across sites and assess their performance characteristics. So, so we are currently working on formalizing the study with all the details. So once we finalize the detail, we will share the protocol and we welcome other data partners to join us as well. So that's it from my end. Yeah.
Okay, cool. Yeah, all those are pretty much our recent initiatives and research projects. And then please allow me to use the next 2 minutes to shamelessly do some advertisement for some of the regional events that as a chapter that we are organizing. So in July, mid-July this year, between 10 to 18th, we are organizing our 5th Singapore Healthcare AI Datathon Expo together with MIT and N6 from New Zealand and Australia. So the event is to create a platform, some workshops and seminars. The objective is to allow our physicians to be able to have a platform to learn and have some hands-on experience with all these cool AI technologies that many of our industry partners have been developing. And also, we organize a datathon, something like our Odyssey's hackathon as well, around not just electronic medical record data, but also some medical imaging data as well. Similarly, with the same objective that we can bring physicians and data scientists to work together. And last year, we were very glad that we attracted over 1,000 physicians and data scientists to join us. And thanks for a lot of the partners in the rooms from all these countries. We do attract quite substantial teams from mainland China, Australia, Taiwan, Japan, and South Korea, and Southeast Asia countries. And to our present supplies, we even have teams from US, Russia, and UAE and Israel. So this year, we are again organizing these datathons online, supporting real data and supporting physicians to test out their real clinical questions with groups of data science. So do check out our websites, and if you have any other questions regarding our events, the Singapore Odyssey chapter, or the studies we have, feel free to drop us an email. As we mentioned, the chapter is open for everyone, and everyone is welcome. Yeah, thank you. And with that, I will do my best to exit stop my sharing. Okay. Yes. Cool.
Thank you very much, Morning. Does anyone have questions for Morning on the Singapore chapter? I have a question.
Yeah.
You guys mentioned that you've been able to convince the Ministry of Industry to, use the OMOP model. Can you guys describe what efforts you guys went through? I'm sure other chapters really would love to, be able to work with their government agencies as well as convince their government agencies to use OMOP, right? So how did you guys go about convincing these guys, your government agency?
Yeah, it's our Ministry of Health. I'm not sure Liam is.
Oh, sorry, Ministry of Health.
Yeah.
Yeah.
Yes.
Hi. So, change of view. Yeah. So I think it's important to make sure you lobby the ministries from early stage to ensure that they are aware of OMOP, because as you know, there are other international data consortiums, and we kind of have to share them and convince them that, look, I mean, having an OMOP common data model allows us to do lots of things, but not least the fact that we can align to future initiatives. And that was something I didn't mention earlier, which is, things like precision health and genomics. We are really looking forward to the Million Genome Project being effected in the US, and I understand, Mui, that they are going to pick OMOP as the data model. So that was one of the things that kind of was quite attractive to the Ministry of Health in Singapore. The other thing was the fact that the Atlas interface was, shall we say, relatively more accessible for clinicians who otherwise don't have, say, computing or base programming kind of capabilities. So it's something much easier for a clinician to access than, say, to use an I2D2 type format. So and we tried the other formats as well. So given these advantages, we put it to the ministry very early on in their exploration of, but how do you get a harmonized common data model for everyone to work together? Thank you.
Wonderful. That's a lot of effort. I'm sure trying to convince, knowing how, the amount of time that Odyssey took to convince the EMA and the FDA, I know for sure you guys must have put in a lot of effort to try to convince them to use the OMOP model. So congratulations on that. And thank you for the effort, right? It's always wonderful to see all these different government agencies join. And even other organizations like you mentioned, right, the genomic stuff, as well as like HL7 is now teaming up with Odyssey to come up with one common model that would work for both HL7 and OMOP. So that was something that was released earlier last month. So it's